Hello everyone, how are y'all doing today? It's time for Let's Talk Sunday. And today's topic, we're going to talk about sciatic nerve pain. Best known for sciatica, okay? It is a health topic I would like to talk about because I just want to share some information that I learned about it myself, dealing with it personally, of course. So I wanted to share what I have learned with my audience, okay? So just sit back, relax, and enjoy the conversation, okay? And I will give you all the information I have, okay? So this will be a part one of the segment because there's so much information for this condition called sciatica. And it is very important that I share. Okay, babies? So let's get into this topic. And here we go. Hello, everyone. Hello. How are y'all doing today? Okay. Today, I've come to you. It's time for Let's Talk Sunday. Let's Talk Sunday is a weekly program that I just, I want to talk about different subjects. Let's talk about these different subjects. So today's topic is about sciatica. Sciatic nerve pain. The condition is sciatica. Okay? So, like I said, my name is Sharice Johnson Moore, and welcome to Let's Talk Sunday. I want to thank you for coming in and being my audience today. Thank you so much. I have been recently diagnosed with this condition called sciatica. And sciatica is nerve pain from an injury or irritation to the sciatic nerve, which originates in your buttocks area. The sciatic nerve is the longest and thickest, almost finger width. It's a real big nerve that fluctuates. It runs through the whole stream of your body, from your head all the way down to your toes. Okay, it's a sciatic nerve. Okay, and in the body, and it's actually made up of 5 nerve roots. Okay, 2 from the lower back region called the lumbar spine, and 3 from the final section of the spine called the sacrum. Okay, the 5 nerve roots come together to form a right and left sciatic nerve on each side of your body. One sciatic nerve runs through your hips, buttocks, and down a leg, ending just below the knee. The sciatic nerve then branches into other nerves, which continue down your leg into your feet and toes. Okay, so like I said, I've been a really, since I've been diagnosed with this, it is sciatic nerve pain. It is when the nerves become pinched, or sciatica pain. That's what they call this. The medical term for it is sciatica pain. Is caused by an irritation inflammation, pinching, or compression of a nerve in the lower back. The common cause is a herniated or slipped disc that causes pressure on the nerve root. Most people with sciatica get better on their own with time and self-care treatments. I wanted to really get into this because whenever I'm a real researcher, and I had this kind of pain way back, way back when I was younger, and I didn't understand the pain then, but I understand the pain now. And when I had it before, when I was younger, I think, okay, this is my thinking. When I had my when I had my children, and I had that us women, we gotta have either, gotta have epidural. I got an epidural, and I've noticed that when I got the epidural after I had my child, I noticed that I will have these pains running down my back. Okay, so I think that's where I got my sciatic nerve pain from. All the years of me being an avid dancer, I love to dance. I love to, I love dancing, and I never had a problem with it. It seems like, I thought it was a phase, maybe, and okay, I'm having the baby, and they give you the needle in your back and things of that nature, and they numb you from the waist down. So kind of like, okay, no problem. So after I had my child, I was thinking that maybe, that pain wasn't going to happen anymore. But it happened to me several times after I had brought my child home, and I noticed I had to lay down, and I really could have no, how could I say it? I really wasn't able to, like, walk. I could walk, but I had to take my time with it because every time I would walk, I had a shooting pain that runs down my leg. It always runs. Mine is in my right leg, so the pain runs from my back down my leg, and I'm sitting there like, okay, all right, maybe that's no problem. It'll go away. That pain is so excruciating. I've never had a pain like that before. You had childbirth and you have the contractions, but there's nothing like a sciatic nerve pain. Okay. But my thing is that sometimes we might overexert ourselves. We might have failed. We might have, failed out some steps, or had a car accident, or whatever the case may be. Or sometimes we're really athletic people, and sometimes that kind of, the nerves get kind of caught up between the herniated discs, and sometimes that can happen as well. And with that, it is sometimes we just don't understand where this pain come from. And recently I say it returned to my body. And I was like, what is going on here? Like, really, what is going on? And my thing was, I said, the pain, you know, I was like, the pain started, and I was like, okay, maybe it'll just go away. Maybe it'll just cease. Maybe it's just temporary. But when the pain grew stronger and stronger, and then it gave me the pain had gotten so excruciating in my back, right there, right there, right there where my buttocks is, and then the pain would shoot down my leg. I was like, oh my goodness, this pain is terrible. So I decided I'll go ahead and go to the hospital. Okay. Sometimes we get this thing, oh no, I want a hospital bill. And look, I'd rather have a bill than be sitting around, can't walk, can't do anything, not mobile, not being able to go up and down steps because the pain was so excruciating. The pain would not go away. So by me being a home health aide, that affected me going to work. And I noticed that I was calling off and calling off. And I was like, okay, well, what am I going to do about this? And I tried to bear it. I tried to bear it a couple of days, take some Tylenol and lay down, take hot baths, things of that nature, put some biofreeze on my back. And that kind of did not work. That was not, it was working, but and then I had to use some of my husband's medical equipment where he suffers from sciatic pain too. So my thing is, I had, and I got to a point where the pain was so, I just couldn't take it anymore. So I turned around and I asked my husband to say, babe, I got to get dressed because I'm going to call the ambulance this morning and go to the hospital to see what this pain is about. So got to the hospital. I was like, I wasn't, I mean, I like going to the hospital. Nothing wrong with hospitals. But it's a different thing when you go there. Okay, it's a different thing when you go there for yourself. But through that, God guided me through the pain. So I decided to do a lot of meditating and praying and things of that nature. And I also was thinking it might be from me not having a good, a bowel movement. Sometimes stuff in our bodies tell us that it's time for us to take care of ourselves. So, and I alleviated that, and then the pain still came back. So I was like, okay, no, this is not good. That's when I decided to go to the hospital. Okay, so sometimes it says true injury to a sciatic nerve, sciatica, is actually rare. But the term sciatica is commonly used to describe any pain that originates in the lower back and radiates down the leg. What this pain shares in common is an injury to a nerve, an irritation, inflammation, pinching, or compression of a nerve in your lower back. If you have sciatica, your experience may be mild. Okay, mine was mild at first. Then it gradually went to severe pain anywhere along the path of the sciatic nerve. That is, anywhere from the lower back through the hips, buttocks, and or down your legs. So the pain started in my lower back and radiated down my right leg. Okay. It can also cause muscle weakness in your leg and foot, which it did that to me. And it really scared me because when I try to get out the bed, it's a thing of you want to stand on both of your feet, right? But that the leg where the pain was radiating down there was a numbness in my thigh, and then it was tingling in my toes. So it says, okay, and it says, yes, it does. It does that. Okay, it says anywhere from the lower back through the hips, buttocks, or down your legs. It can also cause weakness in your leg and foot, numbness in your leg, and an unpleasant tingling pins, which I had, pins and needle sensation in your leg, foot, or toes. Okay, says it says I've already described how sciatica pain feels. It says sometimes it comes in different ways. Sciatica pain is never that's never the same. It's not the same for everyone. Everyone experiences sciatic pain in different forms, different ways. Okay. Some pain is sharp. The pain can be sharp, shooting, or jolts of pain, like you're sitting there and you just had this pain surge down your leg to your toes, and it could be like that. And says, can be described like a burning sensation or electric sensation or stabbing feeling. Stabbing feeling with that. Pain may be, constant, or it may come and go. It comes and goes sometime, and then sometime it could be constant. Well, some days I had the pain so bad I could not get out the bed. I couldn't move. I had to, I couldn't do anything. I couldn't, it hurt to sit up. It hurt to try to sit up. It hurts to lay on one side. It hurts, and then now, I'm just saying this, now I see why some of my patients my patients in the past have experienced sciatica pain, sciatic pain, where they have to turn around and be turned every 2 hours. Now, I say this, you never know what somebody else is experiencing until you experience yourself. So that was my understanding with that. Okay. Sometimes the pain is severe in your leg compared to your lower back. The pain feels worse if you sit or stand for long periods of time, like this, me sitting here. It's not hurting now. It's just this thing of when I try to get out the chair. That's the thing. When I get out the chair, I have this numbness in my leg. I have this numbness, this kind of dull pain in my leg. And it says it feels worse, say, long periods of standing and time. And when you stand up, or when you twist your upper back, your upper body, like turn around like you do like this, or if I do like this, now that hurts. And I'll go to the right, it hurts. So, like I said, it's force and sudden body movement, like a cough or sneeze, can also make the pain worse. Yeah, been that too. So, the question is the question is that how when you have sciatic pain, when you have this pain, do you deal with it, or do you go to the doctor and have, where they got to send you to the chiropractor, or you have to, where you're required to have so much treatment with this pain going on? And the pain, I could say for me, I can't speak for myself. Pain for me has been a change of life. I've had to, I gave up my job because that's how bad the pain was. It was like every day. It started mild, then it started getting worse. Then it got to a point where I couldn't move in the bed. And so I decided to just say, look, I can't keep trying to go to work and trying to make a living, and my body is suffering. So I had to choose. Whether I want to go to work, make money, or I had to turn around and take care of myself. So I decided to go ahead and just take care of myself and let that job go. That was not a easy decision for me. And it made me understand. My husband says, look, you gotta go ahead and you have to take care of yourself. You can't be running around here doing all this crazy stuff and running and doing and this and that. Sit down sometimes, because I'm the type of person where I'm like my grandmother, where I'm doing, cleaning the house, washing clothes, doing laundry, make sure food is prepared, taking care of your house, doing things of that nature, and not really getting a good night's sleep. Plus, they say, it's do you really want to take care of yourself? It comes down to that. because I had to let some things go. Sometimes you have to let some things go. Sometimes stress can bring it. Sometimes stress, and stress and worrying and stressing yourself out. Sometimes that gives your body a sign of you're not getting enough rest and proper sleep. Um, Says can sciatica usually affects only one leg at a time. However, it's possible for sciatica to occur in both legs. It's simply a matter of where the nerve is being pinched along the spinal column. Okay? Sciatica can come on suddenly or gradually. Depends on the cause. A disc herniation can cause sudden pain. Arthritis in the spine develops slowly over time. Do you know that 40% of the people in the U.S. experience sciatica sometime during their life? Back pain is the third most common reason people visit their healthcare providers. Say, we all think about the pain will go away, pain will go away, pain will go away. I'll just do the best I can, do the best I can. But it says, there are risk factors behind risk. There are risk factors with having sciatica. Okay, it says you are at risk. Your risk is higher for sciatica when you have an injury, and when you have an injury or a previous injury. An injury to your lower back or spine puts you at greater risk for sciatica. Says, like say you've been, like I say, you've been in a car accident or things of that nature, or you had a sports injury, or and a lot of that happens when you have the golfers can experience that sciatica because they're twisting. When you hit the ball, you go like, you hit the ball and you go like this, and it twists, and you turn, you're turning your back, and sometimes that can cause you to have an injury or sciatica to come on gradually or slowly. So K says with normal aging, you got normal aging. Normal aging, it says natural wearing down of bone tissue and discs in your spine. Normal aging can put your nerves at risk and being injured or pinched by the changes and shift in the bone, discs, and ligaments. You can experience that. Well, you have that small right there above your buttocks, and it turn around, and you could turn around and injure it, or it wears down, and the cartilage wears down after a while, and then it's just sometimes the nerves, sometimes that happens. It says, um, if you are overweight, if you overweight, okay, your spine is like a vertical crane. Okay, stand straight up. We all seen the pictures of what our spines look like when we stand straight up. Your muscles are the counterweights. Okay, the weight you carry in the front of your body, in the front of your body, in the front of your body is what the spine crane has to lift. The more weight you have, the more back muscle counterweights have to work. This can lead to back strains, pains, and other back issues if you are overweight. So, I'll just say this: I'm not the weight I'm supposed to be. I'm too. I'm a little bit heavier than I'm supposed to be. So, I think I'm gonna start me diet. Maybe that might help my sciatica, losing some of this weight I have. Okay, and then it says, lack of strong core. Your core are the muscles of your back and abdomen. The stronger your core, the more support you'll have for your lower back. Unlike your chest area, where your rib cage provides support, provides support. The only support your back, the only support for your back is your muscles. Says have an active physical, have an you have an active or physical job like me, like I had, like as a nurse, a doctor, a home, someone that stands on their feet all day, or they have, jobs that require heavy lifting, may increase your risk of lower back problems. Well, a patient of mine, a past patient of mine, um, I had to raise her I had to learn. This is before I became a CNA. I used to do it as a living caregiver, and I didn't know the right from wrong of taking care of her and proceeding to move her from the bed to her chair. So that taught me a lot, and that's what really made me. I had my first patient. I was a living caregiver, and the thing is that when you're green, which I was green, I didn't know the right way to move her from the bed to the chair. So that proceeded to make me have back problems. Where I didn't know I had to be waist level with her. I had to rise her bed to waist level to equal the weight out so it wouldn't affect my back when it was time for me to bend over her bed. See, when you bend over, like okay, the bed is supposed to be here. Bed is supposed to be here when you're working with a patient. Has to be at this level here, waist level. So you don't exert all the muscles on your back like that when you move a patient, him or her. And it's always good to have, this is what it's called a turn sheet in the bed when you have your patient. Whether it be a man or woman, have a turn sheet. That's a nice folded sheet under the patient. So you don't have to do all this work on your back. You just have the sheet to move the patient. The sheet helps you move where the back doesn't get too much strain on it. So and it says heavy lifting, like if you lift it, like say UPS man, or you move furniture for a living, and then they always say you have to prevent you from having back pain, you can always have a back brace on. It's always good to have a back brace because that keeps your spine aligned and you don't strain yourself when you're lifting heavy objects. Okay, increase your risk of lower back problems and use of your back, like I said. Okay, or jobs that prolong sitting may increase your risk of low back problems. Okay, if you sit at the desk all day, if you sit at the desk, like I've been sitting in this desk since maybe 7 o'clock this morning. I have decided to take breaks when I come in the office. When I am not feeling pain in my body, I feel like doing work. So, in order for me not to I can sit, but I have to get up and take breaks, walk around your space. You might want to take a break and do some stretching movements, or stretching movements where you're, like this or like this, or get up and walk around for a minute. Get up, walk around, go get you something to drink. If you work at home, if you work in the office, you might want to, take a break and, just go take a walk, just a little walk. And, that will help you from being so stiff and sitting in a chair all day. Lack proper posture in the weight room. Even if you are physically fit and active, you can still be prone to sciatica if you don't follow proper body form during weightlifting or other strength training exercises. So it's always good to have someone there with you that knows, a trainer or your physical fitness coach, or your weightlifting coach, and a personal trainer. Okay, it's good to have those with you when you're doing your weightlifting exercises, because you don't want to turn around and you don't want to hurt you don't want to hurt your body. You want to make your body tone, but you don't want to turn around and overexert the body. Okay, overexert. Because sometimes when you overexert something like weightlifting, it can throw your body out of whack. It can, the muscles and joints and things can kind of, go haywire here. Diabetes. This is something I'm learning. This is something I'm learning these things, so I know I'm an avid researcher. So some of these things I'm just finding out myself, but I want to share these with you. Diabetes increases your chance of nerve damage, which increases your chance of sciatica. I knew that from my previous patient I had before I left my job, that she had diabetes, and her diabetes affected her nerves in her legs, her hands, and her feet, her legs, her thighs and her back. Her diabetes affected her body in that way. Says osteoarthritis. Osteoarthritis can cause damage to your spine and put nerves at risk of injury. Lead an inactive lifestyle. You sit around doing nothing. Sitting long periods of time, not exercising, keeping your muscles moving, flexible, and tone can increase your risk of sciatica. Just sitting around doing nothing can give you back pain. Did not know that. Okay. So, it's just some things, this one. The nicotine in tobacco can cause spinal tissue weaken. Spinal tissue can damage spinal tissue, weaken bones, and speed the wearing down of vertebral disc. Your vertebral disc in your back. Didn't know that. Is the weight of pregnancy the reason why so many? Okay, sometimes pregnant women can get sciatica because the weight that they're carrying causes their back to curve in a way. Curve because the load, because she's carrying the baby in the front, and the body has to contour to where the baby is. Contour her body so the baby can be comfortable. So, and that's why we always see the woman with a curve in her back when she's carrying her baby, maybe in the 7th, 8th, 9th month, because she is carrying the weight in the front, and the back has to do, the muscles and tones have to do the adjusting. Sometimes pregnancy can throw our bodies off whack, but if we exercise and we do everything the doctor tells us, says sciatica can be common in pregnancy. Okay, by increased weight is not the main reason why pregnant women get sciatica. A better reason why they get it is because that certain hormones of pregnancy cause a loosening of their ligaments. Ligaments hold the vertebrae together, protect the disc and spine to become unstable. It can cause the spine to become unstable. It might cause disc to slip, which leads to nerves being pinched and the development of sciatica. Yes, the baby weight has an effect on a pregnant woman. The good news is, the pain goes away after birth. The pain can go away after birth. And physical therapy, massage therapy, and warm showers, heat medication, and other measures can help. Says, if you're pregnant, be sure to follow good posture techniques during pregnancy to also create your, techniques during pregnancy. They can ease your pain. Next episode, I want to thank everybody for coming in. I want to thank everybody for watching. I want to thank my one viewer. Thank you. I greatly, greatly, greatly appreciate you. And I want to say that this has been a very interesting segment for me. Okay. I'm an avid researcher, and I like to teach. I like to teach people other new things. I like to teach, and this is one of my teaching moments, as I say. So I want to teach about sciatic nerve pain today, sciatica. Okay, this is only part one. Next week I come back to you with part two. And I want to give you so much information, and I thank you. I want to give you all the information that you need about this health condition of sciatica. Okay, so my name is Sharice Johnson Moore, and I want to say take care of yourselves and watch what you're doing, how you're eating, and incorporate some of those vegan meals into your appetite, because it cuts down on a lot of health issues that you may have. So I want to say thank you for coming in. Thank you for watching. And you have a blessed day. And thank you for coming out for Let's Talk Sunday with Sharice Johnson Moore. Bye, babies. Y'all have a blessed day, okay? Bye, babies. Hello, everyone, and thank you for listening to Let's Talk Sunday, topic sciatica. I thank you so much for listening, and I love you, and I want to say I have listeners. I have these listeners, and I didn't think my list was this long, but it has gotten long. I want to thank everyone that listens in the United States. I thank you for supporting this podcast. I thank you so much. Okay, I want to say I want to give a shout out to these following countries: Ireland, Nigeria, Germany, India, Singapore, Ghana, Gambia, United Kingdom, and Canada. I want to thank all of my listeners, and thank you for coming in and joining and listening to the program. Okay, I want to say it has been a marvelous time. It has been a pleasure, and keep listening, because I'm always bringing you something informational, inspiring, a word from God, and we always have to thank Him the most. Okay, thank God for everything that you have, people, and don't take things for granted. I want to thank you again for listening to Sharice Johnson Moore's Let's Talk Sunday for March the 7th, 2021. All right, love you. Bye, babies. See y'all later.